Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. The topic is immunizations in older adults, and with me is Matthew Balish. Welcome to the program.
Thank you, Mary.
You are a pharmacist at Pemberton Pharmacy here locally in Salisbury, and of course you're a PharmD and a registered pharmacist.
Yes, ma'am.
And I believe an expert in this topic. First, if you don't mind, let's just talk about immunizations in general. Why are they so important?
Sure. Immunizations are important because they are the best medicine to prevent disease. We know that immunizations have the ability to protect a large number of people with a very low investment in medication. The ability for the immunizations to protect people is known back as far as Edward Jenner and smallpox. And that was the first vaccine that was developed. And now we have vaccines for many preventable diseases: diphtheria, pertussis, measles, mumps, the flu, pneumonia. And this has cut the rate of death by infectious disease tremendously, not only in the first world, United States, Europe, but globally. So immunizations are tremendously important, and everyone needs to think about them.
Of course, you left out hepatitis, too.
I did.
That's another big one.
Yes,
yeah,
hepatitis.
And we're going to talk about the shingles vaccine as well when we talk more about older adults. So this whole concept of herd immunity, I know, is what we like to emphasize.
Herd immunity is tremendous. You think of herd immunity as the example we like to use is you have a herd of buffalo, and if you immunize 80% of the buffalo, the other 20% don't get sick. And that's the same with people. If you immunize about 80% against a disease, you don't have a lot of disease transmission. We see that when we wiped out smallpox. You see that yearly with the flu vaccine. You see that with pertussis, whooping cough, hepatitis A, all sorts of diseases. You can get herd immunity and reduce their transmission. Prior to vaccines, you had 50, 60,000 cases a year of pertussis. Now you have 2,500, 3,000 a year, which is a tremendous drop in disease transmission amongst children. And that is all because of herd immunity and immunization through well visits at your pediatrician. So herd immunity is tremendously important for everyone. Not only children, adults, and older adults all benefit from herd immunity.
And immunizations are safe across the board. I know we had some bad science that happened about 20 years ago that convinced some people, that they shouldn't get their kids immunized. But now we know that is not true.
That is very much not the case. Immunizations are safe, they're effective, they've been proven not to cause autism. There are some risks with immunization, and very briefly, most people that get immunized can have an injection site reaction. They can run a little bit of a fever, which is your body reacting to the vaccine. In some cases, you can have an allergic reaction, but that is usually from an antibiotic or another component when making the vaccine, and those are very rare. I know that there was a lot of people pointed to polio vaccine and the fact that it caused polio initially. That does not happen anymore. Vaccines are produced effectively, safely, and are wonderful products of science. I think a lot of people get confused with injection reaction and not being safe. If you get the flu shot and your arm hurts for a couple of days, a lot of people remember that, and that's a negative connotation. In some older adults, you can get a fever and some malaise or aches and pains from your pneumonia shot. That's your body reacting to the vaccine. It's perfectly normal. It's uncomfortable, but it does happen, and some people mistake that for the vaccine not being safe. The other thing that happens is sometimes people get a flu shot, and 2 weeks later they get sick. They equate it to the vaccine they just got as an improper causation. They're two unrelated facts. So that is a lot of the things that cause people to have that perception that vaccines aren't safe, and that's very much not the case. They're very safe and effective.
Well, what we'll do now, if you don't mind, is turn our
Sure.
attention. In fact, we're going to discuss 3 of the major immunizations that older adults, people
Yes.
65 and older, should get.
Yes.
And we'll start with the flu.
So the flu. The flu is a big one. Every year in the United States, about 25,000 people over the age of 65 die from the flu. The flu is thought typically of something that as it comes, you're sick for a week and it goes away. But as you get older, it gets more dangerous. Your body has a harder time fighting it off, and you can die from it. So it's very important to get your yearly flu shot. Your yearly flu shot is safe. It's cost effective. Even if you have to pay cash for it, it's as little as $20 at your local pharmacy. It's good insurance for not getting sick.
A lot cheaper than a hospitalization
It is
or something.
most definitely
Yeah.
cheaper than a hospitalization. And it's accessible. You can get it through your physician's office. You can get it through your pharmacy. You can get it through your drive-through clinic that the local hospital does every year at the Purdue Stadium. You can go to the health department and get your flu shot. There are so many avenues. People should be getting it every year. In some cases, employers offer flu shots for free because they know that the flu shot cuts down on sick days. It keeps productivity up during the flu season. It's a tremendous thing.
When should you get the flu shot optimally? I know they say you can get it any time, but
You can
October, September?
I tell people as soon as they're available, and that is usually early September, October. And don't wait because there's only a limited production and pharmacies run out. And we see that every year, that there's always a group that waits to the end, and sometimes you don't have it in stock, and it's a shame. And that's just really, they produce X number of million doses, and they distribute them, and once they're gone, they're gone. It's difficult to get them.
And just explain about how they try to plan ahead for the flu shot,
sure.
the strains and such, and sometimes they get it pretty right, and then
Sometimes they do.
occasionally they don't, and then people think, oh, why should I get the flu shot? But it's still important to get it.
It is very important. So every year, the Centers for Disease Control looks at the flu strains that are circulating in Southeast Asia, Vietnam, China, and they surveil those areas, and they watch the flu spread across the globe through Russia, Europe, and eventually to the United States, and they do their best to pick the strain that is the most prominent, making the most people sick. And that's the strain they make the vaccine against. Usually it's 2 strains. And most years they get it pretty right, and most people don't even have to worry about it. Some years, a few years ago, they didn't, and it wasn't a great vaccine. That happens. You still get benefit from it, because even if that vaccine is not perfect, it still gives your body a primer to fight the flu that comes through, and you may have a lesser case from it. So it's, always good to get a flu shot. There is some discussion about whether you should get the injectable kind or the flu mist, and they have their own risks and benefits. Most older adults should get the injectable flu shot. That is the way to go. It's safe, it's effective. If you have a little bit of a low immune system or you're immunocompromised, you definitely should not get the flu mist, which is the live intranasal vaccine that a lot of school kids get. So you have options for your flu shots. Also, there's the high-dose flu shot, and that is like getting 4 flu shots in one. And the theory behind that is, as we get older, our immune system slows down, it's not as efficient, and if we give you more bits and pieces of the flu virus, the theory is your body will make more antibodies and you will be better protected. So if you're over 65, we tell you to get out early and look for that high-dose flu shot if you can get it. But if you don't get the high dose, get a regular one. A flu shot is better than no flu shot, I say.
Because your body will still react and build up its
Exactly.
immunity to
You will
fight it
still-
off. Yeah.
Right, you will build that immunity and you will be better protected than someone who doesn't. And you could prevent a hospital stay, and that's always important.
Now let's move on to the one that's gotten a little bit more complicated, and I'll let you explain, but we're
Sure.
going to talk about the pneumonia vaccine.
Yes. Pneumonia shots have gotten very complicated, and the CDC has, in 2015, revised the guidelines and made it a bit more complex. So you used to be able to, if 19 to 64, if you had diabetes, heart disease, asthma, you were eligible for a pneumonia shot. You got one shot, Pneumovax 23.
That's if you're 19 years of age up to 64 years of age.
With appropriate conditions. So the CDC has these wonderful vaccine tables, and it will tick off conditions that tell you what vaccine you're eligible for. And the big ones are diabetes, heart disease, and asthma. That, you know, your health is not as robust as it perhaps should be, and so we need to protect you a little earlier.
Okay.
But once you get to 65, the old recommendation was you got a pneumonia shot at 65, you wait 5 years, you get another one, and you're done. And that has kind of changed. The new recommendations are over 65, you get Pneumovax 13 first if you're not previously vaccinated. You wait a year, 1 year, then you get Pneumovax 23, which is a new vaccine. Pneumovax 23 and Pneumovax 13 overlap. So in each vaccine, they protect you from 13 strains of bacterial pneumonia. And in Pneumovax 23, they protect you from 23 strains of pneumonia. And there's about a 6-strain overlap, the most virulent strains that we've isolated that cause hospital-acquired and community-acquired pneumonias. And we know every year pneumonias kill about 50,000 elderly every year. So if we can prevent that, we like to do that. So after you wait your year, you get your second shot, and then if you need it, you can get another booster several years later of Pneumovax 23. So we're telling people, talk to your pharmacist, talk to your doctor, find out which vaccine you received first, and you can get that next booster next. And it is creating a lot of confusion, but it is worthwhile getting these shots.
So if you've never gotten the pneumonia vaccine before, once you turn 65, you get the Pneumovax 13.
Yes.
Then you wait just 1 year, to get the Pneumovax 23.
Yes.
Versus, I always remember hearing every 5 years you
Right.
would get the pneumonia vaccine, but that was the old system.
That was the old system.
Okay.
And the CDC revised their guidelines based on a pooled analysis of pneumonia cases in the United States, and they felt that changing the boosting schedule would confer better immunity. In a lot of ways, this change is an evidence-driven experiment to see if we can get better coverage and disease prevention versus the old system, the 5-year boost.
Now, does Medicare pay for that, or is that usually out of pocket?
Medicare most definitely pays for the pneumonia shot. Most people that go to their pharmacy or their doctor, Medicare covers it 100%, which is fantastic.
Oh, yeah.
Medicare also covers 100% your flu shot. So if you're worried about cost, if you're on Medicare, there is no cost. You could walk into your pharmacy today and get both of those shots at no cost to you.
Well, it saves Medicare a lot of money down the line, I think,
does,
for the
most
most part,
definitely.
so they'll pay for that. And that's
Right.
smart. That's smart medicine.
It is very smart medicine.
Now, the third one we want to talk about is the shingles vaccine.
Yes.
And Zostavax, or the shingles vaccine. So tell us about that, and that's been around for a few years now.
It has. So, as you know, shingles is a reemergence of chickenpox. And if you've had chickenpox or the chickenpox vaccine, you are at risk for shingles. And what happens is the chickenpox virus sequesters in your nerves and can come out onto the skin and cause a very painful rash. It can be a debilitating illness. It can cause blindness. It's something you should take seriously. So the Zostavax is something for an immunization for persons over 65. It's essentially a concentrated chickenpox shot that we give you to prime your immune system to get your body to keep that virus in check, to prevent the shingles. It is about 50% effective. So it's about, 1 out of 2 people will prevent a shingles case. But the more important thing is, if you do get shingles after you've had the Zostavax shot, the pain that's experienced from it, as well as the duration, is shorter and less severe.
So you get a less intense version of it?
You get a much less intense version of it, and that is important to know.
Because we always hear about how painful shingles is. And it can last several weeks.
It can last weeks. The post-shingles neuralgia or nerve pain can last months. And it's something that you don't like to see people suffer from. So Zostavax has been out on the market about 10 years. There's wonderful safety data for it. Most people that get the Zostavax shot have a little bit of swelling in the arm, a little bit of redness, but that's about it. In some rarer cases, you can get a chickenpox-like rash as a side effect. And we tell you to keep that covered, stay away from small children for a few days until that goes away, because it is that's one of the few live vaccines we have. It's a live, what we call attenuated or crippled virus. So it gives your body something to react to, but it won't give you a full-blown case of chickenpox or shingles.
Now, Medicare does pay for this, correct?
Medicare does. However, they pay for part of it. They don't pay for 100% in some cases. And this is a problem for some elderly citizens because you're on a fixed income, and the co-pays for the Zostavax are not necessarily inexpensive. Co-pays range from $70 for the shot all the way up to the full cost of about $225. And that is a big economic hurdle that you have to get over to get this shot. The actual cost of the Zostavax vaccine, the average wholesale price is about $400 a dose. So it is an expensive shot, but it is worth it in the long run because you only need one. And if it reduces or eliminates you getting the shingles, it's worth every dollar.
I'm sure some people pay out of pocket for it.
Some people most definitely pay.
Can it run in families where you feel like if a family member had it, then you have a greater chance? And
yes, that is the case. If your blood relative has had shingles, you have a higher probability of experiencing the shingles.
Okay.
But shingles is not something that if your spouse has it, that you can get it transmitted to you just by living in the same house, eating food. It's a failure of the immune system. It's a disease of the self. It comes back.
Okay. Now, in some cases, do any insurance companies pay for it to get it earlier than 65, or you would have to pay out of pocket if you decide to do that?
So there is an indication for people that have had shingles before the age of 50 that you can get it at age 50. Most insurances don't cover it at that point. And that you can pay out of pocket to get it, yes.
Well, it sounds like it might be a smart idea if you can afford it. Yeah.
Now, there are a couple of technical hurdles for that. By protocol in the state of Maryland, you have to be 65 for a pharmacist to immunize you for Zostavax. If you want it earlier than that, we would need a prescription from your doctor.
Oh, okay. That's what I'm thinking of,
yes.
I guess. You would need a prescription.
You would most definitely need a prescription.
Okay, well, very good, very useful information. Yes. What is your final take-home point about immunizations?
My final take-home point for everyone is get your flu shot every year. It is good insurance about not getting the flu. If you're eligible, if you're older, get your pneumonia shot and make sure you get that second booster a year later. And if you have a family history of shingles or you're eligible for the Zostavax, get that as well. Those are the three basic immunizations that an older adult needs to stay healthy. And they will pay dividends, particularly the pneumonia and the flu, because that keeps you out of the hospital. And that is so important.
Exactly. Well, thank you so much for being on the program. Very, very excellent information. And we'll also post some websites you brought. Obviously, the Centers for Disease Control has a lot of great information.
CDC.org. And there's a wonderful website called Immunize.org. Immunize.org has vaccination schedules, recommendations, vaccine information sheets if you want to read about the vaccines ahead of time. So that will tell you about what the content of the vaccine is, side effects, when to call your doctor or pharmacist, things like that.
All great information. Yes. Thanks again.
You're welcome.
And thank you for joining us for this edition of Focus on Health here on PAC 14.